You're watching Exit 1055 with your host, Richard Rose.
Hey, good morning. I'm Richard Rose. Welcome to Exit 1055 Long Island. It's your TV 1055 show about all things Long Island. In just a few moments, hear what the new head of a state oversight agency thinks of Nassau County's finances and how they could be shaped up, what that might mean for Nassau residents. But we begin this morning with the spreading, growing, deadly opioid heroin addiction crisis. It's claiming so many lives, especially on Long Island. CBS radio reporter Rebecca Granet of 1010 WINS News took a closer look at the scourge that is permanently scarring so many families.
That was the Christmas right before we lost him.
Tormented by loss, but still full of love, Valerie Labiak wakes up every morning comforted by the subtle reminders of her son Michael. A framed quilt made from cutouts of his dress shirts hangs on the living room wall of her Long Island home. Pictures from his childhood are displayed in the dining room.
He was just a really funny, really bright, really handsome young man. If this could happen to him, this could happen to anybody.
In less than 10 months, heroin entered Michael's life, wouldn't let go, and killed him. Like so many heroin stories, Michael's struggle with addiction didn't begin with the drug. In 2012, he underwent surgery and was introduced to prescription pain medication. 2 years later, his parents learned that he was abusing the pills.
It was his last visit before he would have entered the police academy, but he failed the drug test. So that's kind of when he had to come and tell us that there was a problem.
Michael started outpatient treatment and detox. It was in treatment that he learned a heroin habit would be much cheaper to maintain than an OxyContin one. Now on heroin, Michael was living in the shadows of his former life. That is, until his father found a syringe outside the family home.
I reached out to people to try to figure out what we could do as parents. But it took me a couple of months, I think, before I even could say heroin.
After having a run-in with the law to support his habit and struggling through a new round of treatment programs, Michael overdosed. His father found him lying on the bathroom floor and used Narcan, an antidote to a heroin overdose, to save his son's life. But that was merely a prelude to the night and the text message that Valerie reviews in her mind to this day.
Friday night, we were home, we had dinner together. He left to go smoke. When he didn't come back after a couple of minutes, I looked outside and I didn't see him. So I texted him.
This is the last conversation Valerie would ever have with her son. At 7:45 p.m., he told his mom that he had taken a walk down the block. And just over 2 hours later, he sent Valerie the text that continues to haunt her.
He texted me at 5 to 10 and said, "I'll be home soon."
But this wasn't just a trip down the block. Instead of going back home, he used his time to head to Jamaica, Queens. After some time in Jamaica, he went back in the direction of home. Michael made his way to the LIRR. He took the 10:02 train out of Jamaica Station and overdosed. About a half hour later, Valerie says a young girl got on the train at the Wantagh station. She approached Michael thinking he was sleeping, but he wasn't. He had passed away in 34 minutes. By the time his mom checked in again via text at 11:08, he was already gone.
I just miss him. I miss his hugs, and he would always say, "I love you," before we hung up the phone or if he was leaving. Always. I miss that.
Today, Valerie shares her family's journey with those who will listen, and she has a message for parents whose children are battling addiction.
I say don't give up, because I would have fought forever for my son.
And through it all, she says she wouldn't give up the 26 years she had with Michael for anything.
Truly an example of this tragedy. Joining us now, several guests. 1010 WINS News reporter Rebecca Granet, whose story we just saw, and who joins us to help moderate our discussion. Warren Zysman, whose family operates treatment centers on Long Island and New York City. Also, Dr. Jeffrey Reynolds, president and CEO of the Family and Children's Association in Mineola. And he was just appointed to Governor Andrew Cuomo's newly created Opioid Heroin Task Force. We want to hear from both of you gentlemen. But let me begin with you, Rebecca. You put together a special series. It was an 8-parter for 1010 WINS. Your thoughts on this crisis?
You know, it is one of the most pervasive and honestly dangerous issues that I think that we're facing in society today. Nothing could have really prepared me and, you know, everyone for going out on this journey. We took a 125-mile drive over the course of several weeks from Toms River, New Jersey, all the way up to Long Island. And what we found, the main takeaway, I think, was that heroin is really everywhere. It's in the neighborhoods that we call home, and it's affecting people that you may have never expected. And so the need to leverage resources, I think, is greater than ever, and that's kind of where this task force comes in. And so, Dr. Reynolds, I wanted to ask you first, being, you know, appointed to this task force, what is step number one? What is the one thing that you guys need to start doing to tackle this issue?
Most importantly, we've got to fill the gaps in the continuum of prevention, treatment, and recovery. So many folks are dying because at every step along the way, whether it's education in schools, whether it's access to treatment on demand, whether it's supporting young people who find a path to recovery, there are deficiencies all along the way. We were woefully unprepared for the onslaught of overdoses that we're seeing. These are all preventable deaths, but we've got to fill those gaps.
Yeah, we definitely see that. This was an example of a young person who wanted to be a police officer, looked like an athlete. Absolutely the last person you would have picked that this happens to. And yet we're finding from teenagers to grandma, people having to deal with this problem. Mr. Zysman, let me ask you, you know, you recall, like everyone else, how 6, 7 years ago we were all like, oh, we got to stop letting people get these opioid pain pills. Just last week we saw the former head of the FDA said maybe they made a mistake allowing the pharmaceutical companies to kind of overprescribe them, push them, some would say. Do you blame the government and even the doctors and the pharmaceutical industries for what's occurred here?
Well, I think there's competing public policy on this. I mean, from a physician perspective, they treat pain based on what a patient reports. In terms of, from a drug treatment perspective, we see that many of these folks who are reporting maybe higher pain than what they actually are experiencing are addicted, because these drugs are addictive substances. What happens is then, when the physician community sees that a person's been abusing pain medication, they'll start to cut them off. If a person doesn't engage in treatment at that point in time, they'll have to turn to street drugs because they feel sick from the withdrawal symptoms. And that's where we're starting to see this heroin scourge really happen, is when they turn to the street drug, they find out pain medicine like oxycodone is $25 a pill, and heroin is only $5 a bag. And so they're going with the less expensive option.
So what should we have done, Dr. Reynolds? I mean, if we could have foreseen this, which we didn't.
Right. We should have developed better alternatives to long-term opioid therapy for folks with chronic pain. Opioids were never designed for chronic pain. They were designed for short-term use of acute pain. Beyond that, the lack of treatment slots out there at this point in time, both inpatient and outpatient, in part because of insurance company denials, is killing our kids left and right. So we've got a problem. We know that the solution is restricting the supply and also addressing the demand. Supply side stuff happens through law enforcement, but reducing the demand comes from making treatment accessible to folks who need it, and we're not doing a good job of that.
Now, are we going to have a better insurance coverage now? I believe the White House has indicated that they want the insurance companies to cover this.
Yeah, there's a group of advocates, including parents who have lost kids, who are saying, you know, the fail first policies where you must go to outpatient treatment before they'll pay for inpatient treatment, the limitations on stays where kids are getting maybe 7 days worth of treatment when they've been using substances for 5 years. All of that, I think, is beginning to fall away because, quite frankly, a lot of these folks who are refused insurance coverage wind up dying of overdoses, or they wind up in our jails or emergency rooms where we all pay the freight.
You pay for it one way or the other, and with a lost life unnecessarily.
Absolutely.
And Rebecca, you saw this very syndrome.
Yeah, absolutely. And you know what else? On top of that, now I wanted to ask Dr. Reynolds as well about these legal injection sites that they're talking about as also another alternative.
Yeah.
And how you feel about that?
You know, I think as things have marched out of control, it makes us think about things that perhaps we haven't contemplated in the past. You know, clearly there's a role for harm reduction as we watch people injecting 15 to 20 times a day. But I have a hard time going to that step before we've made treatment available and really solve the core of the problem. I feel like a lot of these solutions are working on the symptoms that appear right here and now. At the core of this is the fact that this is a chronic, debilitating condition that folks can't get treatment for. Let's provide that treatment. Let's make sure it's available on demand. Then we can talk about syringes and other things.
Yeah, and that's not the only one. People are saying, well, you get the whole spectrum. You have some saying, well, we went overboard with this trying to prescribe relief for pain medication and wound up hooking a generation and their grandparents to boot. So maybe we should go back to cold turkey, where people have to put up with a little pain, or some people suggesting legal heroin injection sites, or perhaps medical marijuana even as an alternative to this. How do you feel about that?
I think with the legal injection sites, one of the things that people are missing is the fact that heroin is an addictive substance. People don't just use once, go home, and stop using. These injection sites, the statistics they're showing are extremely skewed. Things like legalized marijuana may have a role in terms of cancer treatments and things of that nature. However, it's also the way a lot of the public relations work has been done on it is giving very bad imagery to young people and teenagers that they think marijuana isn't that bad. We know people who abuse marijuana don't do as well in school, don't function as well in their home life and personal life, and it affects interpersonal relationships. And the issue here is marijuana is a very dangerous drug when it's abused. If it has some medicinal purposes, the focus should be on the medicinal purposes, not that not desensitizing the significance of the dangers of marijuana.
And of course, opioids are obviously proven to be the #1 kind of gateway towards heroin, but also isn't marijuana something that could prove to be a gateway to
alcohol and marijuana? That's for a lot of young people where this is starting. You know, it doesn't mean that every kid that drinks a beer or smokes a joint is going to go put a needle in their arm, but in a lot of cases we see that progression, particularly for the 1 in 10 that has some predisposition to addiction. The other thing I'd say really clearly is the same kid who's selling your kid pot understands that the profit margin in a $40 Vicodin is a lot better than that dime bag.
So we've already seen some mistakes with what happened with going from opioid and wound up with heroin, so we've got to be careful any path we take. But now we see the government asking for a lot more money for this, proposing quite a bit more money, upwards of $1 billion. What is that money going to be used for? Are we just going to build a gigantic model that we tear down when we decide that treatment wasn't the right way? What is this money supposed to be spent for? What would you spend it for?
The money's supposed to be used for preventing treatment, preventing drug addiction, and also getting treatment services. In terms of what was just talked about before in terms of marijuana, one of the things that's very important to understand is National Institute for Drug Abuse issued a report just this week, and it spoke about what high school seniors are using. And the theme amongst all the drugs that were listed, which were marijuana, oxycodone, Adderall, was that young people are using drugs that they appear to be safe. Things that are prescription pills, things like marijuana, and the reality is these are very dangerous drugs. Things like Adderall is the same classification as cocaine or crack. Things like oxycodone and Vicodin, and also made that list, are the same. So the gateway drug that we're talking about of the past of marijuana and alcohol that Dr. Reynolds mentioned is something we're seeing, but we're seeing a new gateway drug, specifically in young people in Long Island, of drugs that appear safe. They're pills prescribed by doctors, and young people are abusing them for non-medicinal purposes.
So they'll go from one thing to another. That's the lesson we've learned. Unfortunately, we're out of time. You can hear more about this on the radio. 1010 Wins, your special series, can be seen online. We're with Rebecca Granet. We want to thank you for joining us. Warren Zysman, Dr. Jeffrey Reynolds, we wish you well in what you're attempting to do and try to save some lives.